The clinical approach to patients with Icterus. So the pathogenesis. Red blood cells are destroyed, and then hemoglobin becomes bilirubin. The liver takes up bilirubin 1, and then there's lots of bilirubin 1 in the plasma. Then bilirubin 2 is excreted into the intestines via bile. Then bacteria turns bilirubin 2 into urobilinogen. And then urobilinogen is excreted or taken up by the liver. Extremely high bilirubin is called jaundice or icterus. Icterus can be prehepatic, hepatic, or posthepatic. In prehepatic icterus, this is due to hemolysis, so we can see increased bilirubin 1 and decreased red blood cells. In hepatic icterus, there is an inability of the hepatocytes to process bilirubin. This can be due to hepatitis, fibrosis or cirrhosis or neoplasia. We can see an increase of bilirubin 2 and an increase of liver enzymes such as ALT and AST. In posthepatic icterus, this is due to a bile flow obstruction, and we can see a great increase in bilirubin 2 and no urobilinogen. So icterus is the yellow staining of serum or tissues due to excess amount of bilirubin accumulation due to hemoglobin degradation. It can be prehepatic, hepatic, or posthepatic. For detection, we can see a slight bilirubin elevation when we do lab tests. We can see moderately elevated bilirubin when the plasma is yellow, and when bilirubin is extremely elevated, we can see jaundice or icterus. For prehepatic jaundice or icterus, it's caused by hemolysis. The causes are usually mycoplasma, babesia, leptospirosis, or chemicals such as phenothiazine or propylene glycol. In hepatic icterus, there's an inability of the hepatocytes to properly process and transport bilirubin out of the hepatocytes. It can be caused by hepatitis, cirrhosis, neoplasia, portosystemic shunt, or hepatotoxic drugs. It can also be caused by extrahepatic cholestasis in the cases of FIP, canine adenovirus 1, which is Rubart's disease, leptospirosis, salmonella, and toxoplasma. And toxins that cause hepatic icterus are carprofen. In posthepatic icterus, there's an interference of bile flow due to an obstruction. So when there's cholestasis, bile acids increase in the blood. And this leads to the destruction of red blood cells, and then it causes hemolysis. The measurements we look at are total bilirubin, such as TBR, bilirubin 1 and bilirubin 2, bilirubinuria, this is when the kidneys can't excrete bilirubin 1, and also urobilinogen in the urine and stercobilinogen in the feces. In prehepatic icterus, we can see an increase of bilirubin 1, and in the urine we can see hemoglobin, and we can see a decreased hematocrit. In hepatic icterus, we can see an increase of bilirubin 2 in the serum, but in the urine we see no hemoglobin. And we can see elevated liver enzymes such as ALKP, GGT, ALT, and AST. In posthepatic icterus, we can see very increased bilirubin 2, and we can also see increased bilirubin in the urine. So bilirubinuria is the highest in posthepatic icterus. And this also means we see no urobilinogen. For the treatment, we treat according to the cause. So in prehepatic icterus, it can be caused by immune-mediated hemolytic anemia, toxins such as onion, garlics, or paracetamol, infectious diseases such as mycoplasma, babesia, or leptospiro, and it can also be caused by FIP and FIV. In hepatic icterus, it can be caused by inflammation, hepatic lipidosis in felines, cirrhosis, and neoplasia. And posthepatic icterus is caused by a bile duct obstruction. It can be cholestasis, neoplasia, or just a foreign body.